Here's something else to yell about. This stadium holds 100,000 people. About 3/4 of that number contracted syphilis in 1 year recently. The year we first made this film, the number of new cases of gonorrhea was about enough to fill 10 stadiums, 1 million. 5 years later, 2 million. Of these, about 500,000 were teenagers. These aren't nice diseases, but that's no reason to be secretive about them. This is the organism that causes syphilis, a spirochete. Gonorrhea is caused by a bacterium called a gonococcus. There are other kinds of venereal disease, but these are the two common ones. Some kinds of organisms thrive in spoiled foods, some in water, some even on a dry utensil. But the organisms of gonorrhea and syphilis live in people. They die when exposed to air or light or soap and water. You may believe that people get VD from towels or toilet seats or doorknobs. That's a bunch of nonsense. Stop it. Gonorrhea and syphilis are passed from girl to boy, boy to girl, person to person, by sexual contact. This is how these diseases affect the body. The organisms of syphilis may enter the body through the mucous membrane, the moist tissue that lines various inner surfaces of the body, such as those of the sexual organs, the mouth, and the anus. But spirochetes also enter through the skin. It's possible to kill them with soap and water if a person washes thoroughly right after the contact. Even so, they may get into small breaks in the skin. The bacteria of gonorrhea, however, enter the body only through the mucous membrane. Let's follow the progress of gonorrhea, first in the male. In this side view of the male sexual organs, here are the testes where the sperm are produced. From each testis, a duct leads into the penis, joining the tube that carries the urine. This tube is called the urethra. In a male, the bacteria of gonorrhea almost always enter by way of the urethra. The infection causes a painful burning feeling, particularly during urination. The infected tissue produces a thick fluid which flows down the urethra. A boy is almost always able to tell when he has gonorrhea by these two symptoms: the thick fluid at the end of the penis and the painful burning. If not treated, gonorrhea can cause severe urinary problems. Then, as it spreads, scar tissue may form, blocking the tubes leading from the testes. Sperm can't get through, and the boy can't become a father. In the female organs, the progress of gonorrhea is rather different. Here in side view are the vagina and the uterus or womb. The infection is likely to start at this point. It is possible for the bacteria to spread and infect the urethra, the tube through which the urine passes. It is more likely, however, to spread into the fallopian tubes, the tubes between the ovaries and the uterus. A girl's symptoms are usually so slight that she doesn't know she's infected and doesn't realize she will spread the disease. This is the relationship of the fallopian tubes and ovaries viewed from the front. Normally, an ovum matures in the ovary, then passes down a tube on its way to the uterus. Gonorrhea can block the fallopian tubes, sometimes with severe complications. As in a boy, untreated gonorrhea can make a girl sterile. However, a girl with gonorrhea can become a mother. The danger then is that she may transmit the disease to the child when it is born. The bacteria of gonorrhea can also get into the circulatory system in either sex. The blood carries them to other parts of the body, particularly the joints, where they cause swelling and severe pain. The progress of syphilis is very different. Spirochetes are carried almost immediately to other parts of the body by the two transportation systems of the body, the circulatory system and the lymphatic system. A few spirochetes multiply in a short time until the diseased person is carrying around literally billions of them. There is no outward sign for 2 or 3 weeks, or sometimes even as long as 3 months. Then a small sore called a chancre usually appears. It looks painful, but often isn't. Though this one is on a finger, most chancres, of course, are on the sex organs. On a girl, a chancre may be within the vagina, and if so, she frequently won't know about it. A chancre is filled with spirochetes, which can infect another person very easily on contact. With a doctor's treatment, the organisms can be killed quickly, and the chancre will disappear. But a chancre disappears soon, even if not treated. There are still billions of spirochetes inside. In a few weeks, new outward signs may appear, often a rash such as this. It may be on the palms of the hands. Often hair falls out in patches. There may be sores in moist folds of the body, this one behind an ear. There may be sores around the face. These symptoms, too, will disappear even without treatment, but the disease remains. A person may still feel healthy. Syphilis is a slow killer. As time goes on, the spirochetes may settle down in a particular organ such as the liver. They may weaken the heart. They may seriously damage the nervous system. The damage may occur rapidly, or a person may walk around with the disease for 20 or 30 years before it causes crippling, or blindness, a heart attack, mental disease, or death. Another tragic result occurs in pregnancy. A mother with syphilis is likely to transmit it to her baby. What then about treatment for VD? A boy can get to a doctor because he'll almost always know he has gonorrhea. But there are thousands of girls in every city who don't know they have it. Though it is not very pleasant to go and tell the girl or report her name to a doctor, it's really a favor to her. And it's the only way to cut down the huge reservoir of disease that continues to grow and spread. Fortunately, gonorrhea can usually be cured quickly and easily if a person goes to a doctor. And what about recognizing and getting treatment for syphilis? Unfortunately, a small chancre and other later symptoms may hardly be noticed. The important thing is to be suspicious of any sore or rash that appears after sexual intercourse, whether it's days or weeks later. Sure, it's embarrassing to go to a doctor with VD. But embarrassment is hardly a reason for inviting permanent damage. The doctor will do a physical examination and a blood test for syphilis. If he has no personal physician, a boy or girl can locate the public health department. In most cities, there are public clinics which give free treatment for VD. Syphilis can be cured easily. Gonorrhea is becoming more difficult. But neither can be cured by homemade remedies, nor by mail-order medicines, nor by drugs recommended by a friend. It takes a doctor's knowledge to give the right medicine in the right amount for the right number of days. Although VD can be cured even in the late stages, any damage is permanent. Blocked tubes stay blocked. A damaged nervous system is damaged for life. Although a person can walk out cured after a few treatments, there's one more warning. The body usually doesn't become immune. Syphilis and gonorrhea can be caught again. This chain of infection among teenagers raises some troubling questions. We have tried to answer only one: how an individual can break the chain by understanding the diseases and their cure.
But, well, what about the rest of the chain?
How can people keep from getting these diseases?
If getting cured is so simple, why should there be so much VD? Why doesn't everybody go for treatment?
Why is the VD rate so much higher in teenagers than adults? Has it always been that way?
Why do you suppose gonorrhea is spreading so fast among kids?
If all teenagers knew there was so much VD, do you suppose it would change their attitude about, well, towards sexual behavior?
We leave these questions to you.